great to be partners with NAIC and the Center for Insurance Policy and Research. I'm with the National Academy of Social Insurance. You've already heard from our experts, and you'll be hearing more. And I'm really pleased to be here as well. So, you're all experts in your own right, so I want to prime you to start thinking about the questions you're going to ask as we continue our discussion here. You've heard some of the impacts of what's going on with healthcare now in the first session, and now we're going to take a moment. Picture yourselves in 1965, because you're going to be really, I think, at the end of this session, appreciating what's gone on in the last 50 years. In 1965, until July 30th, we really didn't have a program of health insurance for older people and poor people, and those that could afford to buy into health insurance products could, but most couldn't. And a lot of other changes have happened over the 50 years, and we'll hear a lot more about them. But the NAIC was aggressive and active in a lot of areas, but I don't think in health insurance. And some of you may know differently in your various states that you were. But whereas the NAIC got involved back in the 1800s, 1871 is what Wikipedia told me, there were state offices of insurance commissioners that sprang up over time. And I think in 1965, some were more active in a lot of areas other than health insurance as well. So you can fill us in on what's happened with the insurance commissioners' roles since Medicare and Medicaid have come on the scene. But now Medicare covers about 44 million older people and people younger than 65, which was the age you picked for older people at that point, who have disabilities of different types, and about 70 million people who are on the Medicaid program, so poor individuals, some of whom are older as well. So the National Academy of Social Insurance is celebrating the 50 years of Medicare and Medicaid because it sure has created a lot of potential for other kinds of changes and for a healthier America, and in a lot of ways has done that and is doing that, and we'll hear about what we can do to further that as well. What the Academy is doing to celebrate and put a sharp light on the fact that Medicare and Medicaid are 50 years old, but have a lot of other changes going on as well as we do with the healthcare system in general, is on June 23rd. If you happen to be in the D.C. area, please let us know, because on June 23rd we have 3 seminars on aspects of Medicare and Medicaid and some new books that are coming out. And then that evening we celebrate our Robert M. Ball Award, which is being given to a wonderful Medicare a person who developed Medicare in a lot of ways as well as advocacy, and her name is Karen Davis. She worked for the Commonwealth. She ran the Commonwealth Foundation, or Commonwealth Fund, for a number of years and is now at Johns Hopkins University, so you'll hear a lot about that at our awards program on June 23rd. And then fast forwarding to July 24th, right before the actual anniversary of the passage of Medicare and Medicaid, we have a Medicare Academy. So certainly you're all welcome to attend, but we make this available particularly to public policy student interns, and we get a lot of interest and a lot of involvement there. So if you have younger people in your lives, send them to Washington on July 24th, and they can come to our Medicare Academy, or if they're in Washington, let them know that we'll be marketing, then letting them know about that Medicare Academy opportunity. And then on July 30th, a lot will be done to make sure that Medicare and Medicaid are appropriately celebrated. So, starting today, you'll hear first about what Medicare and Medicaid have gone through with 2 of our experts on this, Bob Rosenblatt and Lee Goldberg. You've met both of them, so I won't repeat what's in their bios that you've heard and that you can read. I'll just turn the podium. No, I won't turn the podium. I'll turn the 50-year-old armchairs over to them.
Great. Well, thank you. So Bob and I are going to have a discussion about Medicare and how it's evolved And the backstory behind this is for the last, let's see, it's June, the last 6 months, Bob has been leading a double life. He's, besides being Bob Rosenblatt, Intrepid Reporter 2015, he's been live blogging the creation of Medicare and Medicaid as if he were a congressional correspondent back in 1965, and it was all just unfolding in real time. And so he's been filing these stories every week on what is happening with this Johnson administration to create this health care program, and where's it going in Congress, and what are the new roadblocks, and what are the new procedural events that have happened. And he's been filing stories every week, and they're on the NACI website, and he's going to keep going until July 30th. And I invite everybody to check them out. They're a lot of fun. And so every week he sends these in, and I get to be his editor, right? So we go back and forth about this, and and it's a lot of fun. So Bob and I have been talking about Medicare and the development of Medicare intensively for the last 6 months, and the idea was that we were going to share that a little bit with you. Bob, I guess let's start in the way back. Before the Johnson administration, national health insurance was an issue that came up with a lot of presidents. FDR certainly reinvented the role of government and created a major social insurance program with Social Security. What happened with health care? Why wasn't there a national health insurance program then?
Well, the people who worked on Social Security for FDR were what we would now call liberals, wanted a larger role for government, and they said, let's include health care. And FDR basically said, I don't want to fight with the doctors. The doctors will go nuts over this, so didn't get anywhere in the bill. Harry Truman becomes president. He said, after the war, we need national health care, and he can't get anywhere with Congress. So it's sort of an idea that's hanging around, and the people who worked on Social Security were still thinking about it and saying we have to do it someday, but it wasn't going anywhere. Then Kennedy became president, and the movement sort of, backed by the unions, AFL-CIO, they formed senior citizens groups. They had a big rally in Madison Square Garden. It was very exciting. The very next day or the next week, the AMA rented Madison Square Garden, and the president of the AMA got up and said, our freedom will disappear if we have national health care. And then, remember, in those days, doctors, there were very few women doctors. There were almost all the doctors were men, and then the doctors' wives had a special role. So the AMA hired an actor of moderate fame named Ronald Reagan. Ronald Reagan recorded I guess you would call it an LP, recorded a record, and the doctors' wives organized parties for their neighbors, and they would play Ronald Reagan's record, in which he would explain that our freedoms would disappear if we had national health care. And so it was basically, I guess you could say, the liberals, the AMA versus, the liberals, President Kennedy versus the doctors. And Kennedy was talking about it, but nothing much was really happening.
Yeah. I came into town on Sunday, and I was able to go to the Truman Library, and it was clear looking at the exhibits there. Truman was the first president, even though health care was in the sort of set of issues that advisors talked to FDR about. Truman was actually the first president to publicly come out for some sort of national health insurance. And then, as you said, it was part of Kennedy's legacy. He really campaigned on it, and that did give him momentum. The Johnson administration, Johnson takes over after Kennedy's assassination. How important was this as part of sort of Kennedy's legacy versus something new that Johnson wanted to do?
Well, it was Kennedy's legacy, but one of the great lessons is elections really matter. And then 64 was a landslide. But let me digress a little bit to indicate what politics and society was like in those days. There were two Democratic parties. There were the liberals in the North and the conservatives in the South. And when I say conservative, I mean they were conservative in the way they approached politics. They wanted small government. but they were also basically is a segregationist party. And their feeling is if we have national programs or expand government programs, African Americans will benefit from them, and the ability to keep them suppressed in society will be lessened. So they were always against that. And remember, we're talking about 1965, the Civil Rights Act had just been passed. So Johnson has the Civil Rights Act. But they're saying, well, what can we do? And you know that the Southern Democrats were not going to vote for Medicare. In fact, they had the chairs of the committees. Wilbur Mills was head of Ways and Means, and he had managed to kill it in 1964. The Senate passed it. In a House conference, Wilbur Mills said, no way. Wilbur Mills is a fascinating guy. He was not an arch segregationist. He was very conservative, and he wanted to play a role in national politics. So 64, he kills it. In June, and then in November there's an election, and the Democrats get a huge number of new seats, including Northern liberals. So Wilbur Mills is on the phone with President Johnson, and Johnson says, we got to do this, and you're going to get all the credit. So then in December of 64, Wilbur Mills makes a speech at the Little Rock Chamber of Commerce and says, well, I can support having Social Security, a deduction on Social Security to pay for health care, just as Social Security is taken out of your paycheck to pay for retirement. And then it sort of opens up. So Wilbur Mills and Johnson are having all these private phone calls, the transcripts of which are available. And then we know it's going to happen. It's much likelier to happen. So that gives it momentum. But again, elections make the difference.
Yeah, and that's a fascinating point. So when Bob says that, he talks about Wilbur Mills saying, I could support an expansion of Social Security, we think of this as the creation of the Medicare program, because that's what we know it as. But back then, it was, how are we going to expand Social Security into health? Because this was an amendment to the Social Security Act of 1935. You've set the stage well. The elections in 64 were just a huge political change in landscape. People had been pushing for universal health care for a number of years. So why just a program for seniors?
Well, the feeling was that seniors are sympathetic. A, everybody has parents. B, people aren't working anymore. So you never think of seniors as, quote, those people on welfare. Seniors are, everyone. So it's very sympathetic, whereas if we try for national health care, people will say, well, so-and-so is not working. You should be working and pay for your own health insurance. But everyone loves seniors because people have parents. So that was a sympathetic group. Okay, so the people say, we'll start with seniors and gradually that'll just be a first step. Then we'll have national health insurance. It'll probably come a year or two later. So they start the Part A Medicare. The government is going to use Social Security money. We'll take a deduction from your paycheck. We'll pay for the time in the hospital, but we will only pay for the hospital bill. In effect, but we're not going to pay for the doctors under Social Security because we're still scared of the doctors. And if we try to put it under Social Security, the doctors will go on strike. So we're just going to talk about paying for the hospital. And then remember, a number of people probably half the people had private health insurance. So the Democratic plan was we're just going to pay for the hospital. The Republican plan was we want to be able to pay doctor bills, but we're not going to let the government do it. We'll do it through voluntary insurance. So Representative Burns, who was the leader of the Republicans, said we'll pay for doctors by having a monthly premium and insurance premium. The individual will pay for half of it, and the government will pay for the other half. So we won't get the doctors angry at us. They will still be covered under private insurance.
Yeah.
So A is hospital, B is for doctors.
Right. And, one of the things, we were just talking about this the other day, one theory is that Wilbur Mills allowed Medicare to go forward in 65, and we should talk about the triple layer cake, right? But by combining it with Medicaid And his thought was this will actually stop momentum for national health insurance because we'll have a program that is for the poor. And that'll sort of take care of that political issue. Because before then, you had these state programs for the poor that were really largely ineffective. They were mostly welfare programs. Not that many states actually covered health care. And it was most states didn't even participate. So, Bob, why don't you talk a little bit about the legislative maneuvering that we saw in the Ways and Means Committee back in '65?
Right. Before '65, there was something called the Kerr-Mills bill, which is Senator Kerr of Oklahoma and Wilbur Mills, and they basically said the states are spending a lot of welfare money because hospital costs are going up, and when you're a senior, you go in the hospital, you have no money, who's going to pay for it? So state welfare programs did this. And their feeling was, again, because we have two themes in our society, in our history. There's a liberal theme, government should do stuff, and there's a conservative theme, you work hard, you do it on your own, you should not be bailed out. So those two themes are always clashing. So they had Kerr-Mills, which basically was welfare, and saying, okay, the states will decide to pay your hospital bill when you're old, but you have to be a worthy poor person. You have to have no money, and you have to make sure that you're responsible, and besides that, your kids should probably pay for you too. But if you don't have kids, then we, the state government, will pay for it. So they said, okay, we're going to give more money to the states. This is Mills' idea. So if we give money to the states to take care of poor people who are under 65, we won't have to pass national health insurance. We won't do that. It will still be a state responsibility. So we're going to give a lot more money to the states, and that's the beginning of Medicaid, and no one foresaw how much it would grow. Now, here's the thing. It's under state control, so, again, the state decides you get this for your health care depending upon your income. Each state decides how much income you can have, how much you can have in the bank, and then, whether your family should be responsible to help you out. So that's a welfare approach versus a social insurance approach. So Mills says we're going to have three things, a three-layer cake: hospital under Social Security for people over 65, Part A; B, doctor bills for people over 65, insurance; and C, Medicaid for everyone who's under 65 who's really poor.
Right. So here's Wilbur Mills. He's in the Ways and Means Committee. It's a close vote. You've got the Republicans pushing for, forget this Medicare, just do a poverty-based, means-tested Medicaid program. You've got the AMA weighing in with some other Republicans saying, just do this Part B, the equivalent of a Part B program for doctor's visits. And what does he do?
Well, Mills is secretly discussing with Johnson, and he says one day in a hearing, he surprised everyone, says, let's do the three-layer cake. Everyone will love it. The Democrats, the liberals will get their hospital thing. The Republicans will get their voluntary insurance for doctor bills. And the AMA will like it because the poor people, we're not forcing the doctors to, see the poor people's bills will be paid by Medicaid, by the welfare system. And everyone says, Wilbur Mills is a genius. Why didn't I think of that? Meanwhile, he and Johnson are chuckling because they had worked it out together. And the thing, again, the way it worked in those days, and I learned this from the transcripts, is Mills had absolute control of the committee. The hearings were not even open to the public. Only the members of the committee and the staff could attend. And he and Johnson worked out the deal. And so by then it was inevitable because you then could get the northern liberal votes, and then from the Democrats you can get the Republican votes. So the handful of people opposing it were the Southerners, and they were going to lose. They were simply outnumbered.
Right. And regardless of what party you belong to, I can't imagine any of the recent modern presidents accomplishing such a huge legislative accomplishment and saying, oh, that was all the credit goes to the Ways and Means chairman, right? It's, not conceivable.
And think about this. Here, it's 1965. The Vietnam War is heating up. Civil Rights Act has been passed. Johnson is playing a major role in those. And I don't know how many hours of the day he had. He's also fashioning Medicare. Oh, and one other, so they've got this, it's going to pass, but they still don't know, will the doctors strike, is one thing. And the second thing is they don't know what's going to happen to the hospitals in the South, all of which are segregated, and the African-American doctors don't have privileges at these hospitals. So they sort of downplayed that. They didn't discuss it. Whenever someone would ask about it, they say, well, the civil rights laws apply. But that's, and then sort of jumping forward, Bob Ball, who's Commissioner of Social Security, when they implemented, this is jumping forward just to finish the point, the next year, they actually had the National Guard prepared. And they were going to send troops into the hospitals if the hospitals did not voluntarily integrate, but they did. But that was another, fascinating piece of the history.
Yeah, yeah. I mean, I'm a big fan of the ACA, but the current administration has sort of bent over backwards to give states what they want on a lot of things in terms of implementation with exchanges and things like that. They'll be infinitely flexible. The Johnson administration, when it came to desegregation in the South, was completely inflexible. I mean, people were saying to them, you either can have a health care system or you can have desegregation. You can't have both. And they really were willing to go to the mat and say, no, we're going to have both. And I think the impact from a social justice point of view that Medicare has had on society often isn't recognized. So talk a little bit about, the bill gets out of the Ways and Means Committee, and then it goes to the Senate. And I know lately you've been writing about, some of the things about what's in the bill, what's going to be in, what's going to be out, what's going to be covered, what's not.
Right, and they're still worrying about the doctors possibly striking, so they still have it written that, you go to the hospital and essentially it's only the hospital bill. Then they separate the specialists. It used to be that the hospitals would send you a bill and include radiologists and anesthesiologists, but they're still scared of non-cooperation, so they put that into Part B, saying the doctor bills will all do that. And that's why we have these, weird billing systems today, all these years later, because, Part A for hospital and Part B is separate for the doctors. So they continue to work on that. And what happened was that Johnson's figuring, well, the doctors, we don't know what the doctors are going to do. So he invites the doctors in to talk about how a lot of them had volunteered to go with the military to Vietnam, and he has some heroic doctors. So they're in a press conference. It's in the Oval Office. The press is in. And he's saying, you're doing a wonderful job, and the doctors are basking in the glow and saying it's great. And he says, and of course, you're going to go along with the Medicare bill. And then the head of the AMA looks at the other guys, and they look at all the reporters, and they realize they can't say, no, we're not. So they say, yes, Mr. President, we will, go along with whatever the laws are. So he cast it in a way publicly so they didn't dare go on strike.